Hi, good afternoon. My name is Jeff Kropholler, and I'm the founding partner and president of Quantum Health Benefits. I want to thank everyone for spending a couple minutes with us here today to learn a little bit more about our company and our fully insured supplemental indemnity product. Quantum Health Benefits was initiated to develop a product that we felt would offer very valuable supplemental indemnity benefits to employers and employees nationally that sits on top of their already provided major medical coverage. This plan was designed to help offset all the rising costs of major medical premiums and out-of-pocket costs with additional benefits that provided no out-of-pocket costs to the employee or the employer and could help save the employer between $600 and $900 per employee per year. Our plan is a Section 125 or cafeteria plan. These plans were initiated by the government in 1978, allowing for premium payments to be paid pre-tax, lowering the taxable income of employees and creating a tax savings for both employers and employees combined. In 2010, the Affordable Care Act further tried to make access to valuable employee benefits easier across the country. And as part of that, in 2014, 3 large government agencies approved very specific wellness activities to be able to be reimbursed by insurance carriers across the country as part of these fully insured programs like ours. In 2018, several large AM Best A-rated insurance carriers adopted these programs and started to underwrite them and make them part of their portfolio as offerings to carriers across the country. In 2018, we worked in concert with some of these insurance carriers to develop our plan, and today work with several AM Best A-rated carriers and offer our Quantum Health Benefits program across the country to multiple employees and employers. So what is the Quantum Health Benefits plan? Our plan is an all-inclusive preventive healthcare management program utilizing supplemental indemnity benefits to help offset all of the major medical costs and out-of-pockets that you often see with major medical health coverage. There's no out-of-pocket cost to the employee or the employer, no deductibles, no co-pays, no out-of-pockets. And as a result, the employer will save between $600 and $900 per employee per year. And that savings is recognized from the very first payroll and goes right to the bottom line of the company. So what benefits are in the Quantum Health Benefits plan? As supplemental indemnity benefits, these benefits are paid by the insurance carrier when one of several triggering events occur. We have emergency room coverage, daily hospital confinement coverage. If an employee is admitted to the hospital, it will pay for up to 30 days of confinement. We help with inpatient surgery and anesthesia costs, daily ambulance benefit that covers both ground and air transportation. We have a critical illness benefit that pays up to $2,500 for cancer, heart attack, stroke, and other critical illness diagnosis. We have a very discounted prescription plan. On that plan, there's both an acute and a chronic formulary. On the acute formulary, there's about 300 of the most commonly prescribed medications in the United States, and those come into the employee at $0 or zero cost. There's another 250 or so commonly prescribed medications that are $1 to the employee. And these are available at all participating pharmacies in the towns where your employees work and live. We have a 24-hour-a-day, 7-day-a-week telemedicine and behavioral health benefit that is for the employee and their entire family. The telemedicine allows for access to board-certified doctors within 10 minutes to diagnose and treat a multiple array of different sicknesses, illnesses, et cetera, that you would go to your primary care doctor for, and access to board-certified psychologists and psychiatrists to deal with a myriad of behavioral health issue needs. Loss of a loved one, grieving, stress, anxiety, etc. We have an extremely robust wellness program embedded into our program that we'll go into a little bit more detail about, and an accident plan, both inpatient and outpatient, that pays up to $1,000 per incident. Our telemedicine, again, is offered for the employee and their entire family and covers both telemedicine and behavioral health. We think this is important because an employee doesn't have to take time away from work or their dependent child time away from school to go to a doctor if they're feeling sick for about 95% of what they would go to their primary care doctor to see. We can get a loved one access to a board certified doctor, diagnosed with their issue, and a prescription written to handle that so you can get back to your daily lives and daily activity. And all of this is accessible right on our Quantum Health Benefits app at the fingertips for your employee. The app is both HIPAA compliant and completely secure, and everything underneath our plan is readily available to the employee, and it comes in multiple languages. All of the employee's benefits, their access to the telemedicine and getting a hold of board certified physicians, the entire wellness library, which includes video interactions, blogs, articles, health risk assessments, are all readily available to the employee through the app, and their entire prescription formulary and all of the drugs that are accessible for them when they go to a pharmacy is right at their fingertips, HIPAA compliant and secure through our easy mobile application. So how does a Section 125 program work? As part of a Section 125 or cafeteria plan, a premium to pay for the health coverage provided underneath the program is deducted from the employee's paycheck. This creates a tax savings for both the employer and the employee. The reduction in taxable income creates the $600 to $900 per employee per year savings for the company and creates a tax savings for the employee as well. Meanwhile, because the employee participates in the program, a wellness rider claim payment will be issued by the insurance carrier back into the employee's paycheck every single month, thus ensuring that participation in the plan will never create a reduction in any employee's pay. Under our plan, we have 5 different participation levels, or premium levels, with varying levels of benefit. When enrolled in our company, employees will be automatically placed through our software in the highest premium level of benefits where they don't recognize any negative impact to their pay or income. If, for example, an employee on our Plan 5 or highest premium tier level plan has to come out of pocket to get the benefits out of that plan, our software will automatically move them down to a subsequent lower premium tier plan until such a time as that employee does not have a negative impact to their pay. About 95% of all of our employees qualify for one of our top 2 plans and all of the benefits that are associated with them. As you can see underneath the different types of claim payment payouts that come with each one of the benefits, many of the benefits in our plan are the same regardless of which premium tier you're on. The proactive well care benefit and the inpatient daily confinement and emergency room visits obviously do pay out a little bit better with a higher premium. Off to the right, you can see some of the triggering events that qualify an insurance carrier to cut a claim payment back to the employee on a monthly basis. Doing telemedicine, consultations with medical professionals, video actions throughout the app, different types of screenings and health risk assessments, and health and wellness coaching are all accessible triggering events that allow our insurance carriers to cut those wellness claim payments back to the employee's paycheck every single month. So what does this look like for the employee? Here's a monthly paycheck example of an employee making $50,000 a year. Our software is proprietary and we can work with any payroll reporting system you have. Whether you pay your employees weekly, bi-weekly, or monthly, we can work that same situation out regardless of how any company pays its employees. We use a monthly example in this scenario. With an employee making $50,000 a year, their gross income would be about $4,166. Assuming they had no other pre-tax deductions, that would be their taxable income, generating a tax withholding of about $853. And that's just the red numbers there for federal, Social Security, and Medicare tax added up, thus making the net take-home pay for that employee roughly $3,313. Once enrolled on the Quantum Health Benefits Program, and assuming this employee qualified for the highest premium tier level, a premium deduction of $1,500 would be taken out of the employee's paycheck, reducing their taxable income to $2,666. The associated taxes on that taxable income would be $457, or a reduction of almost $400 from what they were paying previously. At the same time, because the employee participates in the wellness component of the program, a claim payment from the insurance carrier of $1,200 will come right back into the employee's paycheck, thus netting out and making the net take-home pay for the employee $3,409. And because a claim payment from an insurance carrier to an employee is a non-taxable event with regard to an employee's wages, both the premium payment and the claim payment coming back in will just be line items on the employee's pay stub, and the net result to the employee will be a simple increase in take-home pay of about $96, or roughly $1,100 per year, by participating in the program. So how do we help employers? Obviously, from a tax savings perspective, we can save an employer roughly $600 to $900 per employee per year. This is not a credit at the end of the year or a deduction that is taken. These are real savings that happen per pay period and start accumulating from the very first payroll run once a company is enrolled. Further, we can look at a company's already provided major medical and see if there's other areas that we can create additional savings by getting rid of potential benefits that the company's paying for a la carte, or reductions in their major medical coverage that can be offset by the savings that our plan offers to the company. Further, we find that our program is a phenomenal attraction and retention tool for employees. We find that there is less turnover after employees have been enrolled on our program within an organization, because the additional benefits and increase in pay create stickiness to allow those employees to not leave for other opportunities. Further, if a company is looking to attract and hire new talent, management, nurses, teachers, etc., we find that the additional benefits offered by our program that aren't offered potentially by the competition, and the often increase in pay, creates an opportunity to attract better talent to your organization. Further, one of the biggest benefits of working with Quantum Health Benefits is that we do all the work. No additional financial or manpower resources are required from the company to implement our program. We work directly with your human resource and payroll departments, even if your payroll is a third-party provider, to ensure a seamless implementation of the entire program. We work to effectuate the entire enrollment, the education of all the employees, the administration of the plan, and answering of all questions. We offer a 1-800 24-hour-a-day, 7-day-a-week hotline number for both employers and employees to call to answer questions regarding billing issues, claims information, etc. And we provide all payroll reporting for the company on a monthly or weekly basis. When a company is interested in working with our plan, we offer to run a payroll census at no obligation to the company and at our cost solely. Within about 2 to 3 days, we can run what we call an impact analysis, which will show the exact savings that the company will experience by participating in our plan, as well as what that impact will be to every single employee within the organization. From there, if a company wants to enroll, we simply execute a request for coverage and a management services agreement. At that time, the company will be introduced to one of our senior level enrollment managers, who will be your main point of contact through the entire enrollment process. They will help set up all the payroll and human resources calls and walk through the entire implementation and enrollment process from start to finish.